You're watching a special edition of Medical News Network, your trusted source for the latest in medical news and information. I'm Mike Wittgenstein, and thanks for joining us. Today, we take an in-depth look at sleeping disorders, including sleep apnea, with one of the leading providers of cutting-edge treatments available. So if you have trouble sleeping, snore, toss and turn at night, or just always find yourself tired, listless, run down, or maybe you know someone who is, then stick around. You're about to hear some life-changing advice. We'll be right back.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
Welcome back. We're very pleased to have in studio Dr. William Langstaff. Dr. Langstaff is widely known and recognized as a leader in the treatment of sleep disorders. Dr. Langstaff is a member of the American Academy of Sleep Medicine, the American Sleep Apnea Association, and the International Sleep Medicine Association, and focuses on staying on the cutting edge of treatment available today. Dr. Langstaff, welcome to the show.
Thanks for having me, Mike.
Dr. Langstaff, I invited you on the show today to talk about sleep apnea, sleep disorders. But before we get into that, tell me a little bit about your background, your practice, and basically your practice philosophy.
Well, Mike, I've been in practice in dentistry for 30 years in a little town in Villa Park, California. I graduated dental school, Case Western Reserve University, and came to California and never looked back. Been here ever since.
Now your practice, and obviously, you know, before I invited you on, I did a little research, a little background. You've been 30 years in the same spot. Your practice has evolved to include all sorts of things, including, if I'm not mistaken, veneers, implants. What all do you do in your practice?
Just about everything. We do all phases of dentistry that doesn't require putting people to sleep. We'll do root canals, we'll do extractions, we'll do minor tooth movement for orthodontics, we'll do all phases. Within the last 15 years, we started doing expanding our horizons and doing things like dental implants. And
now you told me originally you did dental implants, and I hate to say this, but back in the 70s when they first came out.
Yes, yes. The first dental implants actually were around in the 40s, the late 40s, and didn't really become known in the United States until the 60s and 70s. The problem with dental implants at that time is they weren't ready. The material wasn't really compatible.
Right, you told me they weren't using now they're made out of...
They're made out of titanium. Before they were made out of stainless steel, didn't work. If they had been made out of titanium, they would have worked.
How long have you been doing them as pretty much a regular part of your practice?
Since the early 90s.
Does time and experience make a difference in the placement of them?
Oh, absolutely. And also keeping up with what's going on in the field. It's always changing, always improving. New implant companies are always coming out. There's lots of changes and lots of improvements.
All right, Doc, I know you brought a model to show us what an implant is and how it works. Why don't you take a minute and...
I would love to.
Okay.
This is a model of two implant procedures. The first one I want to show you is a single implant for a front tooth. Basically, a dental implant is a replacement of the root of your tooth. So if you're missing a front tooth and it's not there and the root's not there for whatever reason, this is a replacement of it. So this shows you the implant and the implant itself.
So if you're just missing a single tooth, you can put an implant in.
Right. But the implant is just the root, not the tooth itself. The implant has to heal first, and then later, 2, 3, 4 months, depending on the type of implant you place and make a tooth, just like regular.
And how long will that last?
Usually a lifetime.
All right. Except for an implant, what would normally be the treatment?
The alternative would be to whack down or prepare these two teeth, the two adjacent teeth. Usually these are natural teeth that haven't had any fillings or what we call virgin teeth.
Right.
To whack them, drill them down, and place what we call a 3-unit bridge.
So you're going to take two good teeth on either side and to basically, for lack of a better word, cut them down or destroy them in order to be able to put in a 3-unit bridge.
And the problem with the 3-unit bridge is, according to the insurance companies, they only last 5 years.
And how long does an implant last?
Forever.
Okay. Now I know that you've got to show them in the back actually putting a bridge on an implant if they're missing back teeth, yes?
Well, this is another alternative. This is where if you're missing all your teeth, your posterior teeth, you can place implants to replace the roots that were once there, And again, let the area heal, and then go ahead and place
Place them in.
teeth.
Now, why did you get into implants?
I didn't like whacking down good teeth, and it's a superior procedure.
Okay, if I'm a patient, I'm going out to look for a dentist that's going to do, because it's my understanding that implants are not a recognized specialty, that any dentist in the world could do them. I could take a weekend course and be doing them tomorrow. Is that true?
That's true.
How would I find a good dentist? What would be some questions I'd ask before I got implants done?
I think length of time that the dentist has been placing implants and the background that they've had, the various studies. My background goes back to Misch Institute, which Dr. Carl Misch is the leader in dental implants in the country.
Okay.
And this was a year-long course that I took in order to learn more about dental implants.
Now, you also do veneers.
Yes.
All right, just real quick, before we get into the sleep stuff, let's take a real quick look at a case so people can get an idea of what can be accomplished with it. So let's take a look at the screen.
By the way, I call this my fun time in my practice.
When you get to create new smiles for people?
I love it.
Okay, real quick, tell me what's going on with this gentleman.
Well, this is a gentleman that has been a patient of mine for many, many years. He's an attorney and a trial attorney. So he's been basically facing juries for many, many years with teeth like this. He doesn't smile much. So he decided that he wanted to have, with his wife's encouragement, nice-looking front teeth.
Right, because she's been kissing him like that for years.
I can't see how, but yes, that's true.
So he comes in.
So, right.
Let's take a look at the after picture, because we're running a little short on time and I want to get to the sleep information. You're telling me that now this is a picture of, this is not him done, this is the temporaries on.
Right, exactly. What we do is we create his smile before he even comes in. We wax up and create a model of what it's going to look like, take a mold of that. Then after we prepare his teeth, fill the mold with plastic, place it on his teeth, and now he's got what's going to be like his permanent veneers.
So these aren't permanent. If he doesn't like these, he can change them.
Absolutely.
And have them any way he wants. So is that something that you do with everybody? Is that something, because
Absolutely.
once they're glued in, they're pretty much in.
Right, but at this stage, this is a stage where we can change things and alter things, and with our communication with the laboratory, especially with the internet, being able to send pictures through the internet.
Is your communication with the lab critical?
Absolutely. The lab is the one that fabricates the veneers.
We're going to have to take a quick break. We come back, we're going to talk a little bit more about implants and veneers, but mostly I want to discuss with you sleep apnea, sleep disorders, and the causes and the concerns. But before we go to break, real quick, who can be helped by implants? People who wear dentures?
Absolutely.
People missing. Is there an age limit?
No.
What about veneers? Same thing, any age limit?
Absolutely. Well, you know, they're very young. Things change as they grow, so there's the limit. But once you reach adulthood, it's 18, 19 years old on, any of these procedures can be performed.
All right, we're going to take a quick break. We're in studio with Dr. Langstaff discussing sleep apnea and sleep disorders. We'll be right back.
Mr. and Mrs. Jones, Sally's having some behavioral problems.
I guess that reward system isn't working.
Well, the timeouts weren't either.
You know, parents do find that timeouts aren't...
See?
Well, you're just too lenient.
Well, you're too strict.
No, you are.
Oh, you are.
No, you are.
No, you are.
When adults don't have the answers, they can feel as frustrated as kids. ConnectForKids.org has thousands of resources for helping kids in your community. ConnectForKids.org, guidance for grown-ups.
Welcome back. We're in studio with Dr. Langstaff discussing sleep apnea and sleep disorders and full mouth reconstruction. Okay, Doc, before we went to break, we talked a little bit about implants and veneers. And I know I want to get into sleep apnea, but I wanted to definitely go over these pictures because these made a huge impression to me. You brought me basically two x-rays. The first one we're going to look at right now. And I know everybody can tell, but you see the big white kind of archy part that goes across the bottom? That's the jawbone. Tell me a little bit about what happens.
Well, this is a dentulous mandible.
So that means that the guy's lost all his teeth.
Lost all his teeth.
But he still has all his jawbone.
And this stage is when if implants are going to be done for a patient. This is the stage it should be done. There's